Okay, hi everyone, good afternoon. Thank you so much for joining us today. We're so excited to have you. This will be our first event for Domestic Violence Awareness Week, responding to the COVID-19 crisis, put on by the COVID-19 Task Force on Domestic Violence. So we're really excited to have you and hope you'll join us for the upcoming events later this week as well. So thank you, and we'll go ahead and get started.
I would just like to note that this meeting is being recorded. It will be in speaker view such that only the speakers are in the recording. If you are uncomfortable, however, please feel free to mute yourself, turn off your video, and contact us if you have any questions.
Thank you so much. And then also, we'd also love to get a sense of who's here with us today. So if everyone's just like write their name and where they're from and put it in the chat. We'd love to get to know everyone and see where everyone's calling in from. Thank you. Wow, it's really exciting to see people are calling in from all over the world. We have, people from all over the United States, people from London, Pakistan, Canada. That's exciting. Puerto Rico, the Bahamas. Thank you all so much for being here today. And we're so excited to share our presentation with you and kick off Domestic Violence Awareness Week.
Yeah, definitely keep continuing to put your name in the and where you're from in the chat. We'll also be continuing to admit people who have requested to come in. So if you hear the ding dong, that's what that is. But yeah, we're gonna go ahead and start. So I will share my screen. Ooh, it's loading. Okay, does everyone see it? Yeah, we're good. Okay, cool. So again, just wanted to welcome everyone to Domestic Violence Awareness Week, responding to the COVID-19 crisis. And as Ash mentioned, it's organized by the COVID-19 Task Force on Domestic Violence. Today is the opening event, and it'll be an introduction to domestic violence and the COVID-19 Task Force on Domestic Violence. And we're really happy that you decided to spend your Sunday with us. Okay, so a little bit about us. I am Lita, and my pronouns are she, her, hers. I received a BA in psychology from Harvard University, and then I recently completed my MPhil in criminological research at the University of Cambridge. My background kind of in DV and gender work comes from being a consent advocate and relationship educator as part of Harvard's Office of Sexual Assault Prevention and Response. And then this past year, I became a Women's Aid Ask Me Ambassador, which is through the UK, through a large nonviolent domestic violence nonprofit. And then I also helped run a sexual and reproductive health organization at Harvard called Harvard Sex Week, among some other activities. So that's kind of my background. Ash?
Hi everyone, I'm Ashri. I also graduated from Harvard with a degree in economics, like Lita, in the same year actually. And then I recently graduated from the University of Cambridge with a master's degree in public health. Most of my work in the past has been really focused on sexual violence prevention, actually in developing contexts in Kenya and India. But I've also worked as a consent advocate and relationship educator here in the US on Harvard's campus, and currently doing research at Stanford on intimate partner violence. So that's been really interesting as well. I'm so happy to be here with you all.
Finally, I'm Akshita. I also go by she, her, hers. I too received my BA from Harvard in computer science and statistics. I am a deferred admit to MIT Sloan, and I'm currently a data science consultant at Oliver Wyman.
Awesome. So now that you kind of know us, just a small disclaimer is that, especially for Ash and I, we kind of come into the DV world more from an academic and research standpoint. We are not experts in the field. we are very passionate about this and have kind of done 5+ years in different contexts, volunteering, research, etc. But we want to be cognizant of that. So the first part of our presentation will consist of information kind of learned throughout various trainings and experiences. For us, the last 5 years, it's all quite introductory. And so we'll be using information from various different sources, which we'll cite as we go. So please feel free to kind of look those sources up if you want more information. Do let us know if you have any questions or comments or concerns about any of the information discussed. And then kind of just bear in mind the quote that I learned in one of my trainings at Harvard, which was, we all have things to learn, unlearn, and relearn. So hopefully this can kind of be useful for everyone, no matter what stage you're at in your DV awareness and education journey. Cool. A little bit about contextualizing DV Week. We essentially created it in honor of Domestic Violence Awareness Month, which takes place every October. And so the COVID-19 Task Force on Domestic Violence kind of organized this DV Awareness Week, specifically responding to the COVID-19 crisis. And it consists of a series of Zoom events that will feature not only work from the task force, but also some of our community partners. And it has the ultimate goal of kind of promoting domestic violence awareness, but specifically within the context of this unprecedented time in our history, which is COVID-19. I'm sure you've heard unprecedented quite a bit. And then our programming aims to be accessible to those with and without a background of domestic violence and work. And so kind of this event today will be rather introductory. So kind of making sure that everyone's on the same page for our future events. And hopefully we'll see you guys there later on in the week.
Yeah, so just providing some context with some statistics. Unfortunately, globally, 1 in 4 women experience intimate partner violence or non-partner sexual violence in their lifetime. And although many may think that these issues are contained in developing contexts, we actually see that a lot here in the US as well, with 1 in 4 women experiencing intimate partner violence in their lifetime and 1 in 7 men. And so actually there's some other statistics here. About 24 people per minute on average are victims of rape, physical violence, or stalking here in the United States. And unfortunately, 38% of murders of women are committed by a male intimate partner. So this kind of shows how prevalent this issue is, and also this pervasive burden across contexts. And then just some further statistics. There's 20,000 phone calls made every single day to domestic violence hotlines nationwide. 15% of all violent crime is attributed to domestic violence, and domestic violence costs $8.3 billion every year. And so this shows that domestic violence is not only a problem that has very immediate and devastating consequences for the health and well-being of individuals in the short term and long term, but also has severe economic implications and societal costs as well. Sorry. And also just to note, we as the task force define domestic violence as abuse within the domestic environment, including intimate partner violence, child abuse, and elder abuse. Most of this presentation and our work so far has been focused on intimate partner violence, but tomorrow our main event will be focused on child abuse, and we'll have an expert who's worked in the field for decades actually coming to talk to us. So we hope to see you there. Another important thing to note is that for the majority of our conversation, we'll be using the term survivor instead of victim, but we recognize that many survivors themselves will refer to themselves as victims of domestic violence or victims/survivors. So we respect all language choices, of course. And then, I think this is a really important thing to note. A lot of people assume that domestic violence is about physical or sexual abuse, but it's important to see that there's other really devastating health consequences for all the other types of abuse as well. And so our definition of domestic violence encompasses physical abuse, sexual abuse, emotional and psychological abuse, financial and economic abuse, harassment and stalking, online or digital abuse, reproductive coercion, and coercive control. And we'll actually be going through examples of all of these later on in the conversation.
Awesome. So I'm going to kind of take everyone through kind of very basics of types of abusive behavior. So starting off, is this really helpful? I'm sure if you've worked in the DV sphere, you've seen this power and control wheel before. It's called the Duluth model, and it was created as part of domestic abuse intervention programs. And essentially it's a power and control wheel. And what it shows is that while physical violence and sexual violence occurs as part of domestic violence and is kind of the most severe forms perhaps, at the center of all types of domestic violence is power and control, and that's kind of the unifying thing. That power and control kind of manifests itself in many different behaviors by the perpetrator. And so in addition to kind of physical and sexual violence, which kind of comes to the top of the head when you think of domestic violence often, many of these behaviors are very pervasive and kind of are most common and ones that affect the survivor kind of most perhaps in everyday kind of contexts. So we're going to go through each of these kind of slices of the wheel and just go through so that everyone has a really good idea of the types of behavior that you might see in an abusive relationship in addition to just physical and sexual violence. So zooming in on power and control, as I call it, not just because we're on Zoom, but essentially you might see that a perpetrator uses coercion and threats. And so that can look like making or carrying out threats to do something to the survivor, threatening to leave them, commit suicide, report them to authorities, making them drop charges if law enforcement is involved, making them do illegal things. Another quick note, this is copied directly from the power and control wheel, which is why I have the term her, but I do recognize that that is heteronormative and that abuse occurs for all people. And so we'll be talking about that a little bit later, but just bear with me in terms of this language used right here. In terms of using intimidation, often the perpetrator will make them feel afraid by using looks, actions, or gestures. In addition to just kind of physical violence against the survivor themselves, even just physical violence to the environment can often be used as an intimidation tactic. So smashing things, destroying property, abusing pets, displaying weapons is often a behavior that kind of represents the power and control the perpetrator has. Using emotional abuse, so that might look like putting the person down, making them feel bad, calling them names, humiliating them, using guilt. Gaslighting is a very kind of hot topic word, I'd say, and that's kind of making the survivor think that they're crazy and playing mind games is often a way that control and power is manifested. Especially kind of useful to think about during COVID-19 is using isolation, and that's a huge aspect of what you'll see in domestic violence. So controlling what the survivor does, who they see, who they talk to, what they read, where they go, where they shop, who they're, every which way of their being, limiting outside involvement and using jealousy to kind of justify these actions. Additionally, you'll see minimizing, denying, and blaming. So making light of the abuse and not taking concerns seriously, saying the abuse didn't happen, or often shifting the responsibility for the abusive behavior onto the survivor themselves. If children are involved in a domestic partnership, then often they are used as kind of pawns within the abusive relationship. So you might see that the perpetrator is making the survivor feel guilty about their children, using the children to relay messages. If visitation exists because there's a separation between the two partners, they might use visitation to harass the survivor, threatening to take the children away, things like that. Using male privilege, again, we want to recognize that although that is heteronormative, domestic violence occurs within a system of patriarchy, and so using male violence is a common tool. That might look like treating her like a servant, acting like the master of the castle, making all the big decisions, and kind of being the one to define men, women, and gender roles within the household. Economic abuse is also something really prevalent and very important to note. Preventing a survivor from getting or keeping a job, making her ask for money, giving an allowance, taking money, not letting them have access to kind of family resources. Now, this wasn't included in the power and control wheel, but I think it's really important to note digital abuse because it's becoming more prominent, I'd say, considering how pervasive technology is in our lives as we are all on Zoom right now. And we had a wonderful seminar about this specifically, and you can look to NTAB and other organizations if you want to learn more about this, but kind of going through really quickly some behaviors of digital abuse. It might look like telling you who you can or can't follow or be friends with on social media, using social media to track activities, including spyware, using GPS location services, whether that's on Snap Map or Find Friends, etc. Insulting or humiliating you in posts online, including posting unflattering photos or photos without your consent, sending explicit photos or videos, sex, etc. Again and again, stealing or insisting on being given account passwords so that you can manage their social media accounts or any of their technological accounts, looking through phone, checking on pictures, text, phone records, etc., creating fake social media profiles in the person's name, using them to kind of send messages to others to pretend to be you and embarrass you, isolate you, etc. And so this is kind of, while technology can be super powerful and help survivors in many ways, we also have to note that kind of digital abuse is something that's occurring and that policies and services need to kind of make sure they're aware of and can combat against. And then finally, reproductive coercion. This might look like deciding whether or not you can use contraception, hiding pills, poking holes in condoms, lying about procedures that have occurred, such as vasectomies, promising to withdraw during sex, and then getting caught up in the moment, perhaps, or so, not following through on, what was made, the decision that was made during the consent process, threatening to end the relationship, or threatening to end the relationship if you do or don't have an abortion, or make certain reproductive choices is something really important to note. Awesome, so that was kind of all of the behaviors that we'd see. I guess the point of that section was to really emphasize that while physical and sexual violence is often the first thing that comes to mind, the thing that you'll see in statistics, and that is really important and has devastating consequences for survivors, domestic violence is more than that. It's part of a large, a host of behaviors, and at the center of that is power and control. And so it manifests itself in many different ways, that power and control, but it's all these little abusive behaviors that really create an environment that is toxic and perhaps unsafe to leave. Again, I said I'd touch on intersectionality in domestic violence. So I'd say a lot of times when the media is talking about domestic violence, or when you might be thinking about it, the narrative is often a older, upper middle class white woman as the typical survivor, the perfect victim. But in reality, women of color are disproportionately affected by domestic violence in the United States. So we have rates of DV kind of reported here from the National Intimate Partner Violence and Sexual Violence Survey. And in addition to these rates, there are many barriers that prevent women of color, in particular, from receiving the same services that white women receive. So some factors that might result in underreporting of DV from women of color, of course, keeping in mind that there is heterogeneity within these racial groups, is a distrust in law enforcement. This might be particularly prominent for the African American community, given Black Lives Matter and police violence and police shootings that have become really common recently. Fear that you won't be believed if they're an immigrant, especially you might see this in the Latinx community, fear that they or their partner will be deported, lack of culturally or linguistically appropriate services, lack of financial legal resources, fear that their experience might confirm racial stereotypes, fear of being criminalized, prosecuted, or incarcerated by the legal system, cultural, religious beliefs about gender roles and power dynamics that kind of prevent them from leaving the abuser, and perhaps oppression, including re-victimization, that can kind of be intensified because it's at the intersection of their race, gender, identity, sexual orientation, ability, legal status, whatever it might be, and domestic violence. I'd also like to point out that while we've been talking about women a lot, and kind of assuming that the male is the perpetrator, which is the case in the majority of domestic violence situations, it is also important to look into domestic violence within the LGBTQ+ community. And so taking kind of an intersectional approach, recent research suggests that DV in the LGBTQ community occurs at equal or recent research shows higher rates than in the heterosexual community. And while It might kind of look similar to what you'd see in heterosexual relationships. There are kind of some unique elements. And so there's this really helpful power and control wheel that's kind of modeled off of the one I showed you before, but that includes some unique elements specific to LGBTQ+ relationships. So that might look like threatening to out you, using privilege or ability to pass, reinforcing internalized homophobia, biphobia, transphobia, using offensive pronouns such as it to refer to trans partners, etc. So there are some unique elements that exist within abuse within LGBTQ+ relationships. And then in a similar vein, there are several barriers that exist to addressing domestic does not occur in these types of relationships. Potential homophobia from staff or service providers or from non-LGBTQ+ domestic violence survivors that they might come in contact with, lack of appropriate training and resources regarding LGBTQ domestic violence for service providers, a fear that it kind of might fuel the anti-LGBTQ bias. Specifically for trans individuals, some domestic violence shelters are typically female only, and trans individuals may not be allowed entrance due to gender, genital, legal status, etc. The dangers associated with outing yourself as a DVE survivor within the LGBT community, and kind of outing yourself as queer in that part of your identity to family, friends, service providers, etc. The lack of knowledge that LGBTQ friendly assistance and resources actually exist, and kind of low level of confidence in the effectiveness of the legal system specifically for this marginalized community. So it's really important to take an intersectional approach to all of the conversations we have about DV. Kind of switching gears, lastly, to responding to disclosures, I'd say we took these 4 simple steps from the amazing source, the No More Project. And so if someone does disclose that they are experiencing domestic abuse, I'd say the first thing that you want to do is listen without judgment. So simply listening to what they're saying, letting them know that you're there for them can just make a huge difference. It sounds simple, but it's the truth. Second, tell them you believe them. Survivors often experience self-blame, denial, doubt, etc. So knowing that you believe them might help them kind of pursue other resources, etc. Ask what you can do to help, support their decisions and validate their choices. So if they want someone to just listen to them, do that. If they don't want you to listen, you can support in other ways, helping to create safety plans with them if they are in an immediately dangerous situation might be appropriate. Importantly, respect their confidentiality, and more importantly, or equally importantly, make sure that you do not take control and agency over their lives. If we remember the power and control wheel, the center of domestic violence as we view it is power and control that the perpetrator takes. So what you don't want is by someone disclosing you now being the one to take the power and control away from their lives by saying, okay, now you need to leave the house, you need to go see this resource, you need to do this, that, etc. So making sure that whatever decisions they make, they're the expert in their own experience, they're the ones that have been able to kind of be resilient within this extraordinary circumstance. And so making sure that you do not take control and agency, while encouraging them, of course, to reach out to other services that might be able to help them, such as national hotline, etc. And then always remember to take care of yourself. It can be really overwhelming to deal with unfamiliar situations, and it's important to have self-care routines and always reach out for help if that's what you need. If you can't remember all those steps, I'd say just remember there are, don't say these responses essentially. These are the responses that act as a barrier. So just leave, sounds simple, but again, as we said, they're the ones that know what they need in the situation. They've kept themselves safe and alive up until this point. So that's not a hopeful kind of door opening response. Seems so unlike them. I'm sure it's not that bad, kind of minimizing, denying. Isn't it normal in your culture, especially important for kind of intersectionality as we're talking about it, making excuses and victim blaming, but also equally making sure you're not prying for details. You're not the investigator of the case. You are supposed to be there for support and non-judgment. All right, ending with, I'd say, some myths about domestic violence that I think are really prominent, and kind of going through these really quickly so that if you encounter them with kind of just family, friends, etc., maybe on this next Thanksgiving holiday, nice hot topic, knowing how to respond to kind of these myths that the media, politics, etc., might continue to put forth. So first one, as we've kind of discussed, domestic violence always involves physical violence. As we've discussed, domestic violence can include a range of behaviors, including coercive control, psychological abuse, digital abuse, etc., etc. Domestic violence is a crime of passion, a momentary loss of control. Again, what we really want to come across is that domestic violence is rarely about losing control, it's about taking control. And these are awesome facts, are courtesy of Women's Aid, by the way. So again, domestic abuse is rarely about losing control. It's not a crime of passion, it's about taking control. The perpetrator has control over how they abuse, when they abuse, who they abuse, etc. Next myth, all couples argue. It's not domestic violence, it's just a normal relationship. The reality is that abuse and disagreement are not the same things. As Women's Aid says, different opinions are normal and completely acceptable in healthy relationships, but abuse is not a disagreement. It's the use of all these tactics, but in order to govern and control another person's thinking, options, emotions, and behaviors. There's no equality within the relationship. I'd say that kind of the difference between perhaps a abusive relationship and just like a toxic relationship is that often, as they say, there's a fear that what will happen if they do the wrong thing, say the wrong thing, and leave the relationship. Another myth that you might hear often is, if it was that bad, she'd just leave. Women stay in abusive relationships. All people stay in abusive relationships for many reasons, and it can be really difficult to leave an abusive partner even if they want to, because as you likely know, abuse rarely starts at the beginning of the relationship. It's often later when it's harder to leave. There are lots of reasons in addition to loving the person because you are in a relationship with them. You might be frightened for your life, for the safety of children. You might have nowhere to go, have no financial means, etc. Often abusers isolate their partners from family and friends in order to control them, and so that makes it even more difficult to reach out to people and seek help and exit the relationship if that's what they choose. Women in abusive relationships need support and understanding, not judgment. And then a final one that kind of ties into our next section is domestic violence is a private family matter, not a social issue. Why are we talking about it? As Women's Aid says, violence and abuse against women and children incurs high costs for society. As we mentioned, the $8.3 billion, I think, a year in the US. But when we describe domestic violence as a private family matter, we essentially minimize, condone, and permit it. So we want to explore domestic violence as a societal issue that we can all kind of take part in helping against. And then to end on a happier note, I just want to point out that there is this awesome wheel that's the opposite of the violent behavior and abusive behavior wheel, where power and control is in the middle. And this one is a non-violence wheel where equality is in the middle. And so in relationships, kind of looking towards what you want to see as opposed to what you don't want to see, this can be a helpful tool if you're interested.
Great, thank you so much, Lita, for walking us through the really fundamentals and foundations of domestic violence. And of course, please feel free to go to any of those citations to learn more specifics of each of those issues. I think it's hard to, domestic violence is such a complex and nuanced issue. So I think that it's really important to think about all the intersectionalities and intricacies of this problem. So I encourage you all, myself included, to go out into those sources and learn more about this issue. And so just quickly, I want to transition into talking about the task force itself and how it kind of came about. So for me, I've always been really passionate about violence prevention, and I was actually studying public health during the pandemic. And so it was interesting to see that the majority of the narrative surrounding the pandemic completely ignored and neglected this already marginalized population, which are survivors of intimate partner violence and child abuse and elderly abuse. And so that's how, or that's why we started reaching out to domestic violence organizations in our areas, in our communities and shelters, to try and figure out what was happening during the pandemic and how we could help support survivors during this difficult time. And we identified specific gaps that were, and then we started mobilizing other talented individuals to try and fill those gaps. And that's kind of how the task force first began. So our guiding principle is that no one should have to choose between a virus and violence, and we try to carry that through all of our different works. As I mentioned before, I think it was really shocking for, with the onset of the pandemic, all the main public health advice was to stay at home, but for a lot of people, staying at home could lead to potentially worse health outcomes in very dangerous situations. And so that's why we started the task force to investigate, educate, and advocate on behalf of survivors during the COVID-19 pandemic and beyond.
Great. So now that we understand the fundamentals and foundation of domestic violence, we want to shed light upon what it means to have domestic violence in the context of a global pandemic. So to orient ourselves with some quantitative statistics, we can see that this pervasive issue exists both in a domestic front within the United States and internationally as well. Domestically, we've experienced a 4.3% increase in 911 calls related to DV and a 17% increase in the prevalence of domestic violence abuse. These same trends exist on an international scale as well. Looking at specific cities in China, for example, they've experienced a 3 times increase in the number of domestic violence calls. And the Palestinian Working Women's Society, within the span of just 2 weeks, had 510 more calls related to gender-based violence. So it clearly is very prominent and specifically is exacerbated by this pandemic. And therefore, when trying to understand this problem, both research that has been put out and our own task force research has allowed us to understand the different levers that are at play. Certain factors have been exacerbated both in an increasing and decreasing fashion. Specifically looking at what has increased, there's increased psychological distress, economic stress, and social isolation. But working in conjunction with that is the decreased access to support networks. And the manifestation of all of these trends results in survivors being less likely to reach out for help. And some of the contributing factors include having no safe space to call or a safe place to go. As we know, because of stay-at-home orders, everyone tends to be concentrated in the same areas. Having fewer points of contacts for mandating reporting and worried about getting infected. And this is obviously a trend that exists for everybody, not just survivors alone. And therefore, to transition from this seemingly daunting task of how do we support these survivors and educate ourselves, we have a solution, and that is the work that we have been trying to do through the COVID-19 task force on domestic violence. As Ash had previously mentioned, we have a 3-pronged approach. It is primarily to investigate, educate, and advocate on behalf of survivors during the pandemic through data analysis, outreach efforts, and grassroots activism. On the facet of investigating, we try to aggregate data and quantify the burden of domestic violence. What we want to do is understand the acute challenges that survivors are facing during this crisis. We then translate what we have investigated and use that as a platform to educate. We consolidate and create carefully curated resources that we're able to provide both allies and survivors. Through this, we want to increase awareness and try to engage everybody in such a way that it's productive for society. And finally, we want to advocate. This ensures the long-standing effects actually withstand just this pandemic and are there at an institutional level. And therefore, we form relationships across NGOs and stakeholders to foster an interdisciplinary approach. We want to encourage leaders to, 1, understand the magnitude of this problem, and 2, dedicate the resources economically and in any other fashion to combat the crisis. Speaking more to our team and the task force approach, that concept and thread of intersectionality and an interdisciplinary approach exists here as well. We have both a content development team and data management team with the objective of trying to curate information, both qualitative and quantitatively. They're able to convert the research and data and output analyses that are both accessible to the general population and ideally informative. We then have 3 other teams that are able to take that information that's been generated and have it effectively reach the necessary networks to actually induce change. Our policy and advocacy team aim to amplify the efforts of other teams and work with other networks and specifically NGOs and leadership. Social media heads the interactions with more individuals and specifically bystanders, allies, survivors, and anybody who really wants to educate themselves. And finally, the web management team is able to host all of these resources and provide them in such a way that is ideally accessible and intuitive to any end user for whatever their purpose may be. And with that, what we want to do, especially in light of this global pandemic, is we want to use this time of reckoning as a launchpad to re-energize efforts and initiatives in the domestic violence space. This is a time that we can use this launchpad to really educate and make sure everyone around us understands the magnitude of this issue and the small steps that they can take to help those around them. Our current initiatives are wide and varied, as you may have guessed, through the different teams that we have. We're currently partnering with a working group on COVID-19 and domestic violence of the United Nations and their international summit. We also have over 200,000 informational flyers that we have designed and are trying to distribute across the United States. This provides information to individuals in a relatively subtle way, and we will get into a little more details about this on the next slide. And we've partnered with over 30 organizations and local grocery stores to pin these up on bulletin boards and flyers and ideally educate everyone around us. We have written, designed, and digitized a children's book called Joan's COVID Tale. And as Ash had mentioned, please come please come tomorrow to learn more about child abuse. And actually, we will have a live storytelling of this particular book. We also have our data team that's conducting qualitative surveys on domestic violence across the United States to understand the arc that this pandemic has taken specifically for domestic violence organizations and survivors. And finally, we are trying to file for 501c3 status. And speaking more to those 200,000 informational flyers that we are trying to distribute, this is the sample of the flyer. If you are interested in actually helping, we had a team of several individuals yesterday all through New York, putting these up in different grocery stores. We also want to bookend our week with doing that same thing again this coming weekend. So if you are interested, we're happy to provide you with the resources to go about doing this. Just please reach out to us and we can follow up as necessary. And finally, another initiative that we also have been doing is a newsletter. This goes out on a monthly basis. It allows you to stay abreast with the research we're doing, whatever information we have, or whatever trends we have experienced that we believe are necessary to educate everyone who cares about this issue. And there are also task force updates. So if you're not on our mailing list, do again reach out to us, or also just navigate to our website where you can easily subscribe and be informed about the different trends that we're able to share with everyone. And finally, we do have impact, which is of course important to everybody. With quantifying DV during COVID, we've published several blog posts that are also accessible if anybody is interested in reading about these. We've fundraised over $1,000 for domesticshelters.org, and they support shelters opening during the pandemic, which has of course been an increasingly difficult thing to navigate given the pandemic and of course the economic hardships that everyone is facing during this time. We've hosted seminars, over 13 of them, with over 500 participants, with a myriad of different topics that have been discussed. Some of these have been posted, and if you're ever interested in joining more, there is more information on our website. And speaking of, we do have this website, which serves as a central hub of all the resources we have been able to consolidate. We've had close to 8,000 unique visitors and several continuous monthly visitors as well. Following suit, we have a social media account with thousands and hundreds of followers, and we have launched a Harvard Freshman Day of Service, where 30 people actually spent an entire day with us aggregating data, and this actually feeds into a project that we are currently working on. So we do have, of course, future projects. Our work is clearly not over. The pandemic is not over, and domestic violence is still an issue that persists, as we have learned today. We are producing resources that are translated into different languages that provide individuals with an understanding of domestic violence and how to seek help. We have femicide research, which is a new undertaking that our data management team wants to do to try to map out this particular trend and see if they can glean any insights from that. Social media takeovers, again, to try to spread information to individuals and allow them to learn through different organizations, and state-by-state resources. This feeds back into our Harvard Freshman Day of Service. This is something something that 30 people dedicated their entire day to building up. And what we ideally want to do is have at least a statewide guide to the resources that are accessible for survivors to reach out. So ideally something a little more tailored than what the central hubs have currently. And none of our work would be possible without the guidance and support of our board of directors. We work with 4 different individuals, all who have varying depths of research with this topic, but who have been there to support us through the research we have been doing and everything else in between. And actually tomorrow for our child abuse seminar, we will be joined by one of the individuals on our board of directors, specifically Catherine Robb. So please feel free to join us for that as well.
Awesome. So if any of this intrigued you or you'd like to learn more, please get involved. We do always want more people to help us on the task force if that's something you're interested in. And if not, just following our work, kind of keeping updated, spreading awareness would be really helpful. So you can always email us at COVID-19 taskforcedv@gmail.com. That should be the email that you got this Zoom link from. Also, we have an Instagram, Facebook, and Twitter, so please do follow us. We post all of our content on all 3 platforms. We try to make it as accessible as possible. If you're interested, we have a LinkedIn, so you can check us out on LinkedIn. And then really importantly, we try to record any type of Zoom video session we do, so all of our 13 seminars. And so we have a YouTube channel for that. So check out past seminars and different events throughout this week. If you unfortunately have to miss one, that'll be on our YouTube channel. And then again, our website is an incredible resource. It's been made by wonderful individuals on our task force and is super comprehensive and very easy to use, and it is safe for survivors. So we do have an easy exit feature if that is a concern before going on. Yeah, so thank you guys so much. We'd love for you to come to more events throughout this week, Domestic Violence Awareness Week, responding to the COVID-19 crisis. So to do so, if you haven't already, you can always sign up for more events at our ticket link, which is bit.ly/COVID-19DV week. You can check out the designated website page. So if you go to our website and go to /DV week, that'll be there. We also have a Facebook event for this. So if you follow us on Facebook, you can find our event there, and that way you can kind of invite your friends, colleagues, family members, etc., to join different events throughout our week. This is the schedule of our week. As I mentioned, as Ash and Akshita mentioned, I'm like so tongue-tied. Tomorrow, Monday, we'll have a child abuse during COVID-19 seminar and a storybook reading of the book we created. Tuesday will be on the intersection of domestic violence and politics, so looking at different pieces of legislation that are kind of relevant to the conversation, and then specifically with Election Day coming up next week for the US, we'll be looking at obstacles to voting for survivors of domestic violence. Then Wednesday, our data team will present some of the trends in DV data that they've done, both quantitative and qualitatively. Thursday, we'll have a moderated community discussion. So often in our seminar series, we get feedback that we wish people had more time so that they could kind of ask their questions or engage with others about these really difficult topics. So we'll be having a moderated community discussion then. Friday is our keynote address by Dr. Ruth Glenn. She's the CEO and president of the National Coalition Against Domestic Violence, and she was recently a featured speaker at the Democratic National Convention. So it's super exciting that we have her here with us. And then as we mentioned, Saturday is the day of action. So if you are interested in posting our flyers, please do so. Please reach out to us so that you could do so on this day of action we've created. If not, please donate to domesticshelters.org, to NCIDV, to other places. You can reach out to us if you need advice, etc. And then finally, please, if you are a US citizen, make a plan to vote. Does anyone have any questions? I don't know how we want to do that formatting. Thank you.
Okay, thank you so much again for joining us. If you have any other questions, feel free to put them in the chat and I can read them out, or you can go ahead and turn on your camera and ask us directly. Thank you so much for joining us, and we look forward to having you throughout the rest of the week and onwards too.